I'm just a bill. Yes, I'm only a bill. And I'm sitting here on Capitol Hill. Hi, everybody. So, Florida House Bill 387 was passed by the legislation over a month ago to allow for telehealth to be done for recertification for medical marijuana certifications. Now, since that, though, crickets. The governor has not said whether he's going to sign the bill or what he's going to do, veto it, but let's talk about it. Hey everybody, it's Dr. David there. So for many of us, if we're old enough, we remember Schoolhouse Rock. It certainly made its comeback many times. One of my all-time favorite shirts is my Knowledge is Power shirt from Schoolhouse Rock. Now, this bill that was passed in Florida, and we all know the cartoon. Turns out that the way we were taught, where it gets signed by the governor and then it becomes law, turns out that's not the way it's actually done in Florida. So we're going to talk a little bit about that. But here in the Sunshine State, the governor can now sign this bill because it's been passed by both houses of Congress. And it turns out that here, if he doesn't sign it, it will still go into law. It's just if he vetoes it, it does not. So very different than from the things that we learned growing up. So realistically, hey, I did learn something about that. That's different than the process. But, so it does seem as if unless he does veto it, that this is going to happen. Okay. Now, the thing is this. I am still completely confused as to when it will go into place. When will I be allowed to order telehealth, to do telehealth, to do these recertifications, to spare the patients from having to potentially drive long distances? I've shared before, I have patients throughout the state of Florida, and some of them have to drive many hours to get here for me to do the certification process, since the law does say that there must be a face-to-face same room encounter in order for that to be legitimate. That telehealth was not allowed, even though I could do it in almost every other circumstance in Florida, as long as the patient's care is not compromised by me not laying hands on the patient, which, of course, in this situation, it clearly is not. All right, so the thing is this, and so here is what the Florida law actually is. So, and it differs between whether it's in session, the legislation is in session, which is now not, or if it's out of session. So here's what it says. The governor must sign or veto legislation within 7 days of transmittal, or it becomes law without his/her signature. From what I understand, though, it was not transmitted before the 2023 Florida legislation session ended during the spring. Okay? Now, I'm going to give you a little bit more singing here. This is where we are now with the law since the session has ended. If the legislative session ends and there has been no more than 30 days since the original 7-day deadline, then the governor must sign or veto legislation within 15 days of transmittal, or it becomes a law without being signed. But today it is still just a bill. All right, it's a little something different there. So it does seem as if since the effective date of the law is July 1st, so it seems like he needs to veto it before then, because it is completely not clear to me if it was actually transmitted by the legislators already. So this may have actually already taken place, and this 7-day deadline, and then the 5th to a transmit, and the 15 days after transmittal. So again, I have no idea where we are right now, but it does seem as if July 1st is the important date, and it's still not clear if it goes into place actually on July 15th, July 1st or July 15th. But here's the other issue. We've heard nothing from the Office of Medical Marijuana Use as to what the rules will actually be. We have to document, obviously, physical exams in charts. And of course, if it's a telehealth, we can only document so much in terms of how the patient is interacting with us, how, what their mindset is, etc. But that's obviously all we can do. It's not clear whether we need to check a separate box in the Office of Medical Marijuana Use registry as part of the certification. I'm hoping not. That's not really how I would do any other telehealth, whether it's for controlled substances like I do, like we're allowed to do, or for other things as well. So we'll kind of have to see where that goes. So, well, I guess that's the next question. Hopefully this isn't just an if. again, assuming that there's no veto, that now we're in a win. But sooner than later would be great, because there are people who will benefit from the law the day it goes into effect. So stay tuned. Have a great day.